Hi everyone, Dr. Hanisha here, and for today's Medical Monday, I'm going to be talking about my patient COVID cases as well as testing. But before I get into that, I want to talk about next week's episode, which is going to be about ayahuasca and other psychedelics and their potential with cancer treatment with my mentor and most favorite person on the planet, Dr. Leanna Standish. I am so excited for you all to hear that episode, and I want to mention that next week's episode is the season finale of my podcast for the season. But I'm really excited about that. I will be taking a break for a few months and I'll be back in September with the next season. But I am so excited for you all to hear this last episode, and so excited for you all to catch up on all the other episodes too. So make sure that you do catch up on those episodes while I'm taking a break. Okay? All right, so let's get into the topic. So let's talk about COVID-19 testing a little bit. So right now, from what we know, the nasopharyngeal swab testing, so when you're actually expressing symptoms, you can get that testing done pretty easily, and it's become very readily accessible, at least in where I am in Columbus, Ohio. I'm pretty sure that it's becoming more prevalent kind of everywhere, and that testing has been found to be fairly effective. However, what we aren't so sure about is the antibody testing. So what we found is that the more recent antibody tests are a little bit more accurate than they were initially. So things that the testing that came out in May, some of them have a 97% specificity as well as sensitivity rate, and so they could be highly accurate. However, there's still room for false positives and false negatives, so we're still trying to figure all of that out, and that's the current state of affairs, or current state of just this year in general, just trying to figure things out, right? So other things that I wanted to mention though about testing was, okay, so we had our president Donald Trump. He said that if we stop testing, then we won't have as many cases, which of course, I think most people can realize that just because we're not testing, then that doesn't mean that those people do not have COVID-19, right? That just means that we don't know that they have it. And I think this was a really interesting thing that was said, because oftentimes I want to mention that we do use that as an excuse for a lot of different health conditions, right? So for example, if I would have never tested for my Hashimoto's, I wouldn't have known I had it, but I would have still had it, right? It's not like it would have changed. I still have my Hashimoto's. Same with for people who have high cholesterol, right? Like so much of that is asymptomatic. If you don't test your cholesterol levels, I actually have a 14-year-old patient who I tested all of the functional labs that I normally do for all my patients for her, and she had high cholesterol at the age of 14. And usually it's not even recommended, or most doctors don't even test for any sort of lipid panel, including cholesterol and triglycerides, until people are in their 40s. And so this is why it's really important to test again. And I want to kind of reiterate how important the testing is for COVID, but also why it's important to test for all of these other underlying conditions that can increase your risk of death with COVID as well. So it's so important this is the time to really take charge of your health and reverse your chronic disease that you're dealing with. So whether that's diabetes or hypertension or thyroid issues or gut imbalances, all of these things can impact our immune system and suppress it. It makes it harder for us to deal with any sort of pathogen. And so that could be a bacteria or a virus like COVID-19, or it could be something else, right? And so we want to make sure that we're more resilient and we can come back quicker. Speaking of which, so I have already made a video on my personal story and my mom's story on our experience with COVID-19. And so if you haven't seen that yet, you can go ahead and check that out. But just a quick summary of my experience was that I had symptoms for less than 2 days, and that was most likely because of my lifestyle that I live, where I'm constantly working on the foods that I eat. I exercise daily, I meditate daily, I am I always do things to help manage my stress. I take my supplements, right? I'm doing a lot of things regularly that help me be more resilient. And that is what I hope for you to also do, is what can you do for yourself so that you're more resilient? If anything comes by, you can handle it, right? I'm not saying that you won't get the disease. I mean, I got COVID-19, right? Like, I did get it and I did express with symptoms, but I bounced back much quicker. And that is the reality of when we make ourselves more resilient. And so that's why I really want to talk about how important that is and why that's important. So let's get into the cases or the patients that I've seen who also tested positive for COVID-19. So after I put out the blog post about my experience and the video about my experience and my mom's experience, I had a lot of people reach out to me that tested positive for COVID-19. And I think it ended up, I actually just had 2 more. So right now I've had about 8 people who tested positive for COVID-19, and I've been able to support them with their care. And before seeing me, other than the last 2 that I saw, all 6 of those patients had really bad symptoms. They had like an extremely high fever. You know, it was around 102, so not high enough to go to the hospital, but also and they were struggling with breathing a little bit. They felt extremely lethargic, were coughing, right? All of these symptoms, they all experienced them for at least 7 days, some of them even 14 days before they finally reached out to me, right? And most of them, all they were doing was taking Tylenol. Actually, I think that might be all of them. I think all of them were taking Tylenol to help suppress their fever. And of course, Tylenol doesn't work like that. It just helps, it helps reduce the fever. Yes, it does do that, but it's not actually working on supporting your immune system to fight off whatever this is. And so it can be helpful to mask the symptoms if you're feeling extremely terrible, but it's not actually getting, again, to the root cause of the problem. And so by the time they talked to me, they were feeling so terrible and their fever just didn't go away. Like I said, it went from 7 to 14 days depending on the person. And when I finally got a chance to talk to them and they reached out, I recommended pretty much the same protocol that my mom and I were on. And I recommended that same protocol. Again, you can go back to that podcast and listen to everything that I talk about. But we did higher doses, and we talked about foods to eat and breathing exercises and all of these things that they can do to support their health right then and there. And within every single one of them, within 1 day, started to notice improvements in their symptoms, right? They weren't 100% better within a day, but they started to feel better. And most of them did not have a fever after the 2nd day at all, right? And then within a few days total of doing these things, they started to feel better. And I know people who have had COVID and these mild symptoms for weeks beyond that. And this is why I think that naturopathic medicine, or natural medicine in general, is extremely powerful, because it really is helping to support your immune system. And when we support your immune system and you can strengthen your immune system, you can make yourself more resilient and you can fight off those things. And so whenever I recommend these supplements and herbal teas and breathing exercises and working out in general, if you're not sick, dietary recommendations, all of these things can help us be more resilient. And so that is why I'm so passionate and I love what I do, because I get to see these like benefits and I get to see people improve their health in real time, like immediately. And so I'm really excited that I had the opportunity to help support these people, and I hope I can continue to do that from here on out. But it's also important to address those underlying conditions, right? So I obviously, as a doctor, I asked them their past medical history and their underlying issues, and some of them didn't have any underlying health issues, and some of them had, a few of the women had hypothyroidism, like I myself have too. So yeah, that's definitely a factor, and it's something that we are now going to address for them so that they can be more resilient in the future and not have to deal with those symptoms as long and bounce back quicker. But I think that's all I got for you all today. That was really all I wanted to do, was talk about my cases and bring a little bit more hope. Like, there is hope, right? We can do more than wear masks and wash our hands. Of course, that's important, and continue to follow those CDC recommendations, social distance, whatever we need to do. Those recommendations are there, and they have been found to be effective. But there's more we can do. It's not just about wearing masks and washing our hands. Keep doing those things, but there's more we can do. All right. Well, I hope this was informative and helpful and inspiring and empowering, because that's what I'm trying to do. And I'm so excited. Again, make sure you check out next week's episode where I talked to Dr. Leanna Standish. She was my mentor in med school, and I absolutely love her. I still reach out to her for support all the time, and I'm so grateful for her being in my life, and her perspective on ayahuasca and psychedelics and how they can potentially help improve outcomes with patients with cancer is really profound. And I think it's a really very fascinating episode, and I think a lot of you will really enjoy it. So make sure you check that out. And like I said, it is a season finale, so I'm really excited for that too. All right, well, I will see you all later. Wishing you all Mahan health, and I will see you next time.